Welcome to Cutting Edge Pain Relief, and today we're talking about ketamine and pain relief. And what I want to make clear is today is a talk that is very science oriented. It's very science based, but we're going to find a way to be able to make this digestible, understandable, and most importantly, useful for those of you who this may be a prudent treatment for, or for those people that you care about. If we haven't met, I'm Dr. Orlando Landrum, a regenerative medicine and individual pain physician. And on this channel, we really endeavor to try to be able to present options for pain relief that many patients may not have heard of. And although I know this context of science seems incredibly scary, we're going to find a way to be able to make that not quite as difficult to be able to understand, and find ways for you to be able to ask questions throughout so I can explain to you exactly what's going on. Today, we're using two main papers as our basis for explaining how ketamine is useful in pain relief. For those of you who don't know, ketamine is an anesthetic. It was originally developed in the 1960s. It was originally utilized and based off of a PCP type component, but since then has found novel use, particularly for mental health issues like depression, anxiety, and OCD. But it's also found a fair amount of utilization for pain relief. And when we look at pain relief, we're really trying to figure out, how is this working, right? At the end of the day, the short answer and synopsis is there are actually multiple different ways that it affects pain relief. And because of that, we really want you to understand that it's not just one particular pathway. And that particular pathway, because there's multiple ones, can affect different types of pain. By the way, thanks for those of you who have joined. In particular, we always appreciate Elaine joining in. Glad to have you here during our live stream. For those of you who are watching at a later point in time, if you have questions that you really want to have answered about this topic, please leave them in the comments below, and we'll be able to kind of give you some answers that hopefully will give you what it is that you need. So two papers that we're going to talk about are, first is the following paper, Ketamine Use for Cancer and Chronic Pain Management. Ironically enough, one of the authors was actually an instructor of mine in Boston, where I trained, and now is in a different location, but phenomenal physician. And then the second paper is a paper that was published within Pain Physician, that's Ketamine, an update on the cellular and subcellular mechanisms with implications for clinical practice. So take a breath. Woosah. All right. I know that title seems incredibly intimidating, but know again that we're going to find a way to be able to kind of explain it. And if you have questions and you're on our live stream, jump right in. So let's talk about what is ketamine right off the bat. So ketamine actually has a chemical structure like this. So you may not know what an enantiomer is, but we're going to explain that from a chemistry standpoint. If you can see at the bottom, there's something that's an S and there's something that's an R. So when we look at things traditionally in chemistry, we can see sometimes there are mirror images, kind of like what most people's hands are. And there's a mixture of those two compounds in the final product. And that's certainly the case for ketamine. So there's a mixture, and those mixtures affect different processes, meaning molecular systems of how we are really trying to be able to either get anesthesia, mood stabilization, or pain relief in a different manner. Everyone keeping up with me so far? Okay. So one of the ways that we talk about how ketamine can be able to provide benefit is the following. It's by it affecting a certain type of receptor. And mainly when you hear medical literature, physicians, healthcare providers, nurse practitioners, other individuals talk about how ketamine works, they will refer to this as being the primary mechanism behind how it works. So I know it looks daunting, but give me a second. So in essence, what you're looking at is a membrane, meaning so like a cell membrane with a wall, and you're looking at a channel. And that channel affects that cell and how it functions. In this particular context, What we're talking about is a receptor that is spelled N as in Nancy, M as in mom, D as in David, A as in apple. So the NMDA receptor. Traditionally, most people who are explaining how ketamine works, particularly in the context of pain, will stop right there and not go into a lot of detail. But I want people who are watching our channel to have an understanding not only of where we start from, but also where we end. So the NMDA receptor is implicated in a lot of treatments for pain. So it has potential utilization when we talk about things like Neurontin or gabapentin or Lyrica and other neuropathic pain medicines within that vein of treatment arms. It has potential implications when we talk about neuromodulation, specifically things like spinal cord stimulation and how it affects central sensitization, meaning how that pain component connects in from a peripheral injury. So like, let's say you hit your hand and it became a painful issue, and then that connects into the spinal cord and then connects into the brain. How those things interrelate, the NMDA receptor is frequently thought to make that more prevalent or more prolific. And if you can find ways to be able to stop its action, meaning an NMDA, using a fancy word, antagonist, or in other words, blocker, it can be able to stop some of those actions from occurring. So for those of you who probably have watched a number of like mystery movies and have been able to kind of say like, you know what, I know who this person is and where we're going with this plot. You are correct. Ketamine has an NMDA function where it blocks the elements of how it would normally function that would cause a propagation of an action potential and other elements and molecular systems within the construct of a cell. But there are other ways, as we see within the construct of this papers plural, that talk about other ways that it works for pain relief. And one of those is the following. So it affects something that's called an astrocyte. So what it reads as it's stated here is ketamine has been in targeted treatments of neuropathic pain and is believed to inhibit the development and lessen the severity of neuropathic pain by inhibiting the inflammatory signaling pathway of some glial cell types, which is associated with the development of pain states. So an astrocyte is a type of nerve type cell that is associated with the neuron that has implications on how it functions. And so by affecting kind of these, if you would, sort of if you thought about the analogy of Batman and Robin, these Robin type cells, which then prevent the regular cell from being able to work as well, it actually prevents neuropathic pain or helps limit its degree and severity. One of the other things that's listed is ketamine and neuropathic pain has been fueled by not only it being providing analgesia, but also stopping the development and advancement of neuropathic pain at its source. So how do we interpret that and what does that mean? What that basically means is that maybe we're not just treating this after the fact. So there's a pain and now we're trying to make that pain less. Maybe we're preventing that pain from actually worsening or stopping it before it continues to get worse from where it might have been initially a small element. One of the other things it has potential implications for is something that is opioid-induced hyperalgesia. So I know, again, for those of you who are watching, this is seeming like a science class with a lot of big words, but bear with me for a minute. So since maybe the late 90s, early 2000s, there's been a premise of something that's called opioid-induced hyperalgesia, or OIH for short. What that basically means is that medications that are opioid-type painkillers can possibly be able to cause an increase in pain when they're used for a prolonged period of time. And we've looked at ways to try to see how could we be able to stop if you're giving a painkiller and the pain's actually worsened with the medicine, which is really counterintuitive, but we believe this isn't the case. What can we be able to do about it? Well, part of this article talks about how opioid-induced hyperalgesia is potentially due to the overaction and stimulation of that receptor that we talked about before, the NMDA receptor. And by influencing this NMDA receptor, we can be able to influence this pain that can occur, particularly with high dose opioids. So another potential benefit. And in this construct, it talks about how long ketamine can be able to last, particularly for a pain reducer or pain treatment. So one of the things that they state is that there was significant pain reduction for at least 4 weeks and many times as long as 8 weeks after an infusion, and that ketamine itself, when they did a meta-analysis and compared multiple different studies, I want to say it was somewhere around 7 collectively, they were able to see that it gave significant relief, and it was for a number of different conditions, specifically neuropathic, but also some non-neuropathic treatment options as well. And this was different than just a traditional anesthetic type treatment of how it would work, but more so for traditional pain type options. So when we look at this, basically what we can be able to deduce is that this is certainly another alternative treatment option that really can be able to provide relief that we otherwise wouldn't necessarily think about. So I know a number of my current patients are saying, well, if this is so good, why don't you guys offer it at your own office? Well, as a matter of fact, we do, but we do it a little bit differently. Not only do we provide ketamine, but we're not looking for just a treatment. We want to be able to identify how your problem is both the way you describe it in kind of a subjective manner, but also objectively, we want to be able to provide you a way to be able to measure different scales of how it starts and how we've made an impact so we can be able to show it. And so there's a couple different things that we use for that. One is, it's alluded to in the previous video, that's called NeuroFlow, the type of app that allows for us to really be able to dig in and kind of get a log of things like depression, sleep, pain, anxiety scales. That's pretty easy. It takes all the kind of guesswork out of it. And then the second is a way that we take a look at what's going on in your brain and how it's potentially affected by your pain and by other issues that might be causing you an issue. And we can see that in a pictorial representation. And what we want to see is how can we be able to improve that post-treatment so we can have an idea about how it's really affecting you. So when we go back to talking about ketamine, one of the things that we really want to kind of get into are things about what are the different structures that it impacts. But before we do that, I want to take a quick little break, and we're going to come right back to talking about ketamine. And we want to field any questions that you guys might have about how this might be impactful for someone like yourself or someone that you care about, and go forward from there. All right. Be right back with you in just a little bit. Okay, so what we're talking about today is ketamine and pain relief and some of the different pathways behind how it works. So when we talk about that, one of the things that we want to kind of identify is the following is, so we know that it can be used from an anesthetic standpoint. And now we know that it has some analgesic properties, meaning that it can be able to be a potential pain reliever. But in addition to this, it also can be fast acting and improving on mood and potentially being able to reduce suicide within hours of administration. So I'm going to take a divergence from all the different slides and talk and just kind of talk to you person to person, heart to heart for a second. For a good number of my patients that come to me that have pain, they very seldom talk about how it affects them as a person and how it affects them in terms of how they feel. If you live with pain for days, for weeks, for months on end, it prevents you from being able to do a number of things that you really would want to be able to do. Sometimes the things that are probably most important to you. And that takes a toll. It takes an emotional toll because it takes away from you a part of really who you are and what brings enjoyment and fulfillment. It is not hard to imagine how that can make someone depressed, anxious, and have challenges with their sleep. But most of the patients I know are not how sometimes media characterizes them as being catastrophizing or malingering or whining about what's happening with their pain. Many times, those individuals that have some of the most severe pain feel like they need to be the most stoic and that their effects are not interrelated with what's going on from their pain. As we just talked in a video recently, we talked about how the connection of pain and depression are actually connected from a neuroanatomical standpoint, or at least so we believe, in many similar neurons and tracks of how they run very closely in approximation. And so accordingly, it's not just you not being tough enough or being a victim of your circumstances, but anatomically, physiologically, the two are interrelated. And so what we really need to be able to do is to find a way to embrace all of that as a whole of a person and figure out how we can improve that. For some of my patients who have had the most severe pain, one of the things that they have said at times, sometimes in jest and sometimes in all seriousness, is, I don't know if I want to continue having this pain. And I'm thinking about whether I really want to continue doing this. And in essence, what that's saying is they're contemplating whether suicide is a potential option. First and foremost, when someone has that kind of thought process, we really hope that there can be someone that you can be able to talk to, that you can have as a resource, that can be there for you so you can really put out the things that are troubling you and hopefully can give you insight about your value and how you can be able to find ways to address those challenges and troubles. It's very ironic to me that we talk about suicidal ideation and very seldom talk about it in the context of chronic pain. As a practice as a whole, one of the things our practice is looking to do is to find ways that we can be able to try to address this from a broader scope. And it doesn't mean just give pharmacologic measures like, oh, let's put you on an SSRI or another type of medication, or even having an infusion type therapy. What we need to figure out is where you're starting from and how we can get you to a position and a place that actually feels like normal or close to normal. So one of the things that, and the reason why we're looking at ketamine and using ketamine and really kind of leaning into this is not just for its pain properties, but also its properties of how do you get that whole of you to feel and be closer to where you were before this affliction really caused you all these challenges and issues. So when we talk about the problems and issues of pain, it's not just a nociceptive construct. And nociceptive is basically in fancy language, meaning it's only about the pure physical sensation of pain and how the neuron processes it. It's also about those regulatory processes from the brain about how you interpret it and how your mood impacts it. And it's not just that you can always will yourself to change that mood and immediately change your pain. Sometimes we need to be able to have adjuncts, kind of assistances of how to be able to get to that good place. So as we get back into the elements of ketamine, one of the things that we see is that it spans a large physiologic array of different processes. And it can be able to affect things like the NMDA receptor. It can affect substance P receptors. It can be able to affect things like astrocytes or glial activity, as we made mention of before. It can even be able to affect different synaptic channels. And because of this, as it states in those last few sentences, ketamine elicited analgesia represents an intrinsic advantage over other therapeutic options because it has a multitude of different ways to treat. So what does that mean? What that means is sometimes when we try a pain therapy, whether it's a medication or intervention or whatever else, it tries to treat the problem through one mechanism alone. So what I would say is, let's say that you have some type of fire that's there and you try to put it out with water, but it's a type of fire that doesn't respond to water. And if all you got is water, then it may not be the way to be able to really kind of fix this problem. You may need to do something of a differing nature in order to try and treat this problem. And what ketamine can be able to provide is multiple solution options within the body to be able to try and treat pain. And that's one of the reasons why it has a fair amount of advantage. So let's go into that with even a little bit more depth and detail. So I know this slide looks pretty daunting, but what it actually is a breakdown of how it affects different pathways and through what different mechanisms it does this by. So if you look at the bottom left, it talks about the modulation of MUSC dependent nociception, and it affects it through that receptor. If you look at the modulation of long-term potentiation pathways, which is the middle box, it does it by affecting that NMDA receptor and basically stops some of the central sensitization. If you look at how it affects other pathways, it deals with calcium and phosphate and changes how the sympathetic activity can affect different things. It also looks at BDNF protein and how it can be able to challenge and deal with things like upregulation of AMPA, as well as other pathways that can potentially be able to improve mood and pain as a whole. So why am I talking about all these things and fanciness? Because I want you to understand that when a doc says it's only an NMDA and you think to yourself and you do some research and some Google look and you say, yeah, but I can get that by using, this type of medication. Maybe it's something like a tapentadol. Maybe it's something like potential methadone. Maybe it's something like a topical agent. Maybe it's something like an oral type medication. Yeah, but that might be one of the pathways where we're talking about being able to deploy 4 or 5 at the same time simultaneously in order to be able to give you benefit. And so that's really what we're talking about with how it can be able to provide you some degree of benefit. When we look at those breakdowns, we can look at how it affects the brain in particular. And so how ketamine affects the brain is in the following construct. It can be able to affect it by looking at things like the different receptors that modulate things like the TRPV1 modulation of neuropathic pain that's present within a part of the brain that's called the ventral medial medulla. Or we can be able to address it by going through other receptors that deal with the prefrontal cortex and sort of that cognitive understanding about what's happening with pain. And when we look at those two areas, which are completely different, using 2 different receptors, it makes a huge impact on not just the different pathways, but different structures from a brain standpoint. And then finally, when we look at the actual channel, the synaptic channel itself, there's a multitude of ways of how ketamine affects it. So if we're looking at that channel, presynaptic, postsynaptic, which again in regular English means the nerve that begins, that then releases different types of neurotransmitters, and then it goes to these channels that then can cause different problems. And then that robin that we made earlier mention of, that's glia or astrocyte type treatments that kind of help facilitate this. Ketamine has a role on all of these different types of treatment options. It can affect the ones that release neurotransmitters. It can affect the receptors that are receiving the neurotransmitters. But at the end of the day, What really we're most interested in is how we can be able to stop the pain by using multiple different options and at the same time being able to improve overall mood, sensation, and hopefully being able to prevent that pain from being worsened. So that's what we're talking about when we're really looking at ketamine and how it provides a unique pain relief, how it differentiates itself from other different pain treatment options, and how it might be something in your armamentarium or your physician's armamentarium that might be able to provide you some pain relief and really be able to give you a sustainable treatment option where others previously haven't been able to be found. For those of you who are local to us and you're interested in potentially talking with us some more or getting some more information, again, if you go to either our website or you give us a call at 574-404-PAIN or just shoot us a quick email, we can be able to get you some more information about different ways that ketamine has synergistic effects with other treatment options and how we deploy it specifically in our practice, which is a little bit unique and different. Again, thank you for those of you who joined us live. And thank you for those who are watching this at a later point in time. We really hope this impacts you in some type of way and helps you get your quality of life back, lets you be able to punch pain in the face and get back to leading the life that you deserve. Thank you so much and have a great day.